Welcome to another Doctor's Express Medical Minute.
I am Dr. Evangeline Specht. I'm a board-certified internist at AFC Doctors Express. We have been seeing a lot of ear infections that have been coming into our clinics, and the first question they ask us is it swimmer's ear or is it a regular ear infection? A regular ear infection, or an otitis media, or a middle ear infection, is an infection that's caused by pressure in the middle ear. It can also cause pain, but it's usually preceded by an upper respiratory infection or a cold. A swimmer's ear, on the other hand, is not usually associated with an upper respiratory infection. It comes about from fluid in the outer ear canal or from swimming. So what is swimmer's ear? Swimmer's ear is an infection along the lining of the ear, from the eardrum to the outer ear. What are your symptoms of a swimmer's ear? There are mild symptoms, moderate symptoms, and severe symptoms. Mild symptoms are itching, pain when you're pulling on the ear this way, or pain when you're pushing on the ear this way. You will not have those symptoms if you're having a middle ear infection. You can also have drainage from the ear, or you could feel like your ear is clogged. Severe symptoms of swimmer's ear is when your ear gets swollen, you have pain down into your neck, tender lymph nodes, a high fever, and discharge that could be smelly or not smelly. These types of symptoms, you need to go immediately to the emergency room. Swimmer's ear is a bacterial infection and will definitely need to be treated with antibiotics. A middle ear infection, on the other hand, can be treated with antibacterial medication, or it could be caused by a virus. How do we treat swimmer's ear? When you're seen in our offices, we will examine your ear. We will make sure that your eardrum is intact. And if there's any debris in your ear, we will try to remove it as best we can, because swimmer's ear can cause a lot of pain. Once we have made sure that the eardrum is intact, we will give you ear drops that you will use 2 to 3 times a day for the next 7 days. What should you do while you're on the medication to prevent further infection or to help with your symptoms of pain? When you put your eardrops in, the ear that's infected should be up. You should not go swimming. You should try to prevent any fluid in the ear canal, so that when you're bathing, you could use a cotton ball with petroleum jelly, put it in there so that no fluid goes into there. No flying and no swimming, as well as no putting of earplugs into your ear. How do you prevent swimmer's ear? One, you should watch out for swimming in areas that have high bacterial count. You should try to avoid putting anything in your ear, cleaning it out with Q-tips or sharp objects so that you don't have abrasions along the canal. Try not to use earplugs as often as most children will put earplugs in hours in a day. And try to, once your ear is wet, try to get all the fluid out by tilting your head this way. There is a home remedy that you can use. It's 1 part vinegar and 1 part alcohol. This will help keep the ear canal dry. I would only use that if you know that your eardrum is intact. Some providers will say to use that right away. I don't totally agree with that. I think that if the eardrum is ruptured, you do not want to put anything in that eardrum. So if you're having any symptoms of a swimmer's ear, please come into our offices. We're open 7 days a week. We're on the phone. As I said in the past, a swimmer's ear is a bacterial infection and will need to be treated with an antibiotic.
This has been a Doctor's Express Medical Minute. Doctor's Express Urgent Care has locations throughout New Jersey, New York, Connecticut, and Massachusetts. For locations near you, visit doctorsexpress.com.